So I think with regard to the China perspective, we already see tailwinds coming there. Healthcare is clearly going to be a priority for any administration in the United States, and access to healthcare and cost controls will be important, and that's where biogenerics and generics more widely play a crucial role. I think it's already the case in the United States that nearly 9 out of 10 prescriptions written in the United States are written for generic drugs, and Biocon is well placed to support that going forward through its biosimilars business and through its generics business.
Okay, so the key takeaway here is basically Trump 2.0 could prove to be advantageous for Indian pharma, including Biocon. And mid and longer term, I know Biocon is banking on anti-obesity drugs to drive growth mid and long term for the company. And, you know, this whole thing about Wegovy, it's basically not just blown up on social media. You know, demand is so strong that not just Novo Nordisk, but Novo as well as Eli Lilly just can't keep up with demand. I know you are working on a similar weight loss drug to Wegovy. I guess it'll be a GLP drug there. Talk to us about how progress on that is going. That's one. And two, ethically, how you get around marketing a drug like this when, you know, I mean, drugs like this were obviously made originally for diabetes. People are taking it now to lose weight, when the simpler, in some ways, thing to do would be, look, just go into a calorie deficit, eat less and work out more.
Sure, that's a lot to unpack. Let me start with where we sit with our launch plans. And for us, this is getting very exciting. You know, our first GLP generic liraglutide will be launched in the UK later this month, you know, and we hope to follow that on with further launches in Europe and the US, you know, next fiscal. And liraglutide is the first of a range of GLP peptides that we're developing. So beyond lira, we're developing semaglutide and tirzepatide, the other two major GLP drugs that are, as you've described, you know, having a significant impact in the market today. So we're excited about that. You know, it's a very important strategic launch for us before the end of this year, you know, and heralds, I think, our strategic position in that wider GLP market, and along with insulins, where we are already a major global supplier, positions us differentially in the biogeneric field for what is increasingly being called the diabesity epidemic.